Hello everyone, and welcome to Nursing 421, the Med-Surg Nursing Care 2. This particular course is a very important one as you progress through nursing school, because in this course you will learn how to apply the information in order to provide the best care and yield the best outcomes for the patient. The course covers a variety of topics, from starting in Module 1 with hematology, to Module 2 infection HIV, Module 3 musculoskeletal, and arthritis, hepatitis, endocrine system, chronic neurologic disorders, some orthopedic, peripheral neurological disorders, patients with stroke, sensory and integumentary system. It will be a very busy course covering all these topics with 4 exams, 4 individual exams, one final comprehensive exam. Again, the main focus of the course is to really dig deeper using the nursing process, using some nursing tools that we will provide for you in the live sessions, maybe via announcements, where you will take that information and apply it in the clinical practice. So it is going to be a lot of application, nursing care, nursing management / interprofessional care, knowing medications, what do they do, what to look for when you give somebody the medication, what can you do once that person experiences some type of acute reaction, or whether it's again, it could be a patient with a stroke. How can we take care of that patient? What can we do clinically to improve patient outcomes? So it is all mostly about application. So in this recording, I will go over a bunch of things, such as reviewing the syllabus, something about the announcements, what's included in the modules, ExamSoft, Kaplan, weekly live sessions, and reiterating the exams. So when I review the syllabus, I'm going to click on the syllabus here. The course description, again, it focuses on increasing the complexity of the illness, the nursing process in the adult population, the complex physiological and psychological stressors, and the principles of patient care management. It is a 4-credit hour, 2 didactic, 2 clinical. Course objectives here. The required textbook, it's going to be Lewis, Henkeper, and Dirksen. The medication calculation book is here as well from Morris, and the recommended text from Mosby's Manual of Diagnostic and Laboratory Tests from Pagana K and Pagana T. So the learning activities are going to revolve around the exams, obviously. Each individual exam is going to have 50 questions, and each of the exams will cover content specific to the listed modules. The format of the questions will be both multiple choice and alternate format questions utilizing the NCLEX format. You will have dosage calculations as well on these exams. The comprehensive final exam will be a 100-question cumulative NCLEX-style examination. The format of the question will be both, again, multiple choice and alternate format questions. In regards to clinical, you will participate in an 84-hour clinical experience in a med-surg setting. You must pass the clinical in order to pass the course and advance to the next course. Kaplan exam and remediation. You will take one Kaplan exam in the course, complete the required remediation, 2 minutes per incorrectly answered question, and submit your remediation report as proof of completion. The clinical case study assignment. This comprehensive assignment is at the end of the course, will be due in week 14. It will require you to gather information to complete the assignment in the clinical setting during the semester and must include a minimum of 3 scholarly resources and be written in an APA format. You will also have 2 math quizzes that will prepare you for each of the individual exams. These quizzes are online and timed. These questions will be randomly selected for each student from a pool that covers all medication calculation question types. We will also have weekly discussions that will prompt you to work through each week. These will range from creating case studies, finding resources, or writing questions for your peers to answer based on assigned diagnosis, disorders, or disease processes. The discussion boards will require you to apply the concepts. Okay, the key term throughout this course for 421 course, it's going to be apply. Apply the concept, apply the content, apply the data that you learn, that you gain through each of the modules. So it will require a significant amount of work, so I highly encourage that you stay proactive with your studies. Please review the discussion board description and specifications for more information. We will also carry synchronous online learning sessions. We use a website called WebEx. Each week, myself and Professor Doro, for now, we only have 2 faculty teaching 421 sections. We'll schedule an online session related to that module's content. This session will create a voice-visual learning environment. The date and time of the session each week will be scheduled at the beginning of the semester, so we will send you an announcement, and that is why it's very important that you check the announcements that come so you can stay on track with the updates. But for this one, we will send a schedule that has Professor Doro's link from the WebEx and the link from my account. So you will see that one week Professor Doro will teach. The next week it could be me. Next week it could be her. So we will alternate. So it's important that you pay attention to that attachment that we will include for the synchronous online learning sessions. The session is not mandatory, but highly encouraged, as it will allow you to navigate through the content live with your faculty member. Besides asking reflective questions, we will also practice some practice test questions in regards to those specific modules for that week. We will provide guidelines that will help you track your learning, improve your learning experience from your questions and our questions that arise during the course. Course requirements. Weekly discussions are 25% of the grade. Clinical case study, 10%. 4 individual exams, 40%. The comprehensive final is 15%. The Kaplan exam is 2.5%. The Kaplan remediation is 2.5%. The med-math quizzes are 5%. And the clinical component is a pass or fail. No extra credit will be offered for the courses in the nursing program. It is important to note that while you may have a 90%, it may show as a 90% on Canvas as a grade, but if you do not have a weighted exam average, and I am referring to the 4-unit tests here and the comprehensive final, if you do not have a weighted exam average of 77 or higher, then you will not be able to pass this course. No grade higher than a C may be earned unless the weighted exam average is 77 or higher. Clinical requirements. Attendance is required for all assigned clinical days. Should a student be absent, he or she must notify the clinical instructor in advance. Prompt attendance at all clinical sites is expected. The student must pass the clinical component of the course in order to successfully progress in the nursing curriculum. Failure of the clinical component of the course will result in failure of Nursing 421. You may also refer to the Student Clinical Manual 421 for additional information. Clinical dress code. Please refer to the Student Handbook. If you have any questions about the dress code, please see your clinical faculty prior to arriving at the clinical site. In regards to the clinical packet, you may click on this link here. Clinical evaluation. The clinical instructor will evaluate your progress through direct interaction and observation of the student performance on the clinical unit. The student performance as well as your written work will be used to determine if the course outcomes have been satisfactorily achieved as outlined in the clinical evaluation criteria form. Again, for the clinical component, a grade of pass, fail will be assigned. Health status. Please refer to the Student Handbook for health status requirements for clinical. Communication and tips for success. It is important that you have adequate computer skills in order to be successful in the program. A working computer with a minimum software required of Microsoft Office 2010 Student Edition, that you are able to create and save and print text documents in Microsoft Word, that you are able to navigate Banner, Canvas, make sure that you have access, send and receive email using the Utica College webmail. Please refrain from using personal email when you are communicating with faculty, whether it's didactic or clinical. Make sure that you always use a Utica email. And make sure that you follow procedures. Make sure that you access and use the library resources located on internet website and search engines and such. There are some helpful websites. If there is a technical issue, you may also reach out to the computer help desk. The phone number and the email is here. You can also contact course delivery support, and there are instructions on how to do that. Canvas support is available 24/7. There's a link for library resources. Communication, the Utica email is the best way to stay in touch with each other and faculty. If you have any personal concerns, please use my Utica email address to express your individual concerns in order to maintain the privacy and confidentiality between you and faculty. If there are questions in regards to the course, you are more than welcome to post them under Ask the Faculty thread so everyone can benefit from those questions. Professional and etiquette and respect is expected at all times. In regards to the APA format, you must refer to the American Psychological Association manual book to adhere to those guidelines. Again, Ask the Professor is a discussion area for you to ask any questions related to the course. But if it is a question that it's personal, then you must use the professor's Utica email to reach out to the professor. I ask that you reach out to your faculty in charge of your section first before you reach out to the lead faculty. That way, we respect the borders of each other. If you do not hear anything from the faculty in charge of your section within 48 hours, then you may also reach out to the lead faculty for additional assistance. Again, course email is the best line of communication. The course is structured around weekly learning modules. These are the commitments that you can expect from myself and the other faculty in the course. We are committed to respond to your emails within 24 to 48 hours. We are committed to read, grade, and respond to your assignments within 7 days after the due date. We are committed to log in and check course website at least once a day during the week and at least once on weekends. We are committed to read every blog and or discussion board posting and respond when appropriate. These are some of the policy statements here in regards to academic honesty, grading policy, and course cancellation. I ask that academic honesty is maintained, the integrity is maintained, as you will become nurses and you will care for patients, and it is important that you learn the information rather than plagiarize the information, so you can hopefully be safe in the clinical practice and give the best care for your patients. Please do not discuss exams with one another or questions with one another, especially if another group has not taken that particular exam. We want all students to be successful, but we also want students to demonstrate intellectual honesty and integrity while taking the tests. There's a late policy in here that you can read. If there's special needs, please reach out to your faculty. Testing policies here. I highly recommend that you read all of these on your own. I am reiterating some of the major points. There is a grading scale here, and this is the course summary overall. All the way to the end here. So this is the syllabus. The announcements are going to be posted here for you. I ask that you check these announcements frequently, as the announcements will contain important information for you. Under modules, you will see discussion, assignments, and readings for that particular module. possible clinical paperwork. So there's a clinical module here, and then module 1 has nursing care for patients with hematologic disorders, for example. So you will click on that. You have module outcomes. You have the assigned reading. You have the assigned videos. And sometimes you will have some links as well. Exploring the following website, for example, so you can click on that. And practicing. So you will use Evolve. So make sure that you register with a Utica account for Evolve to access practice test questions, student practice test questions on Evolve. And make sure that you register with Kaplan to also practice test questions. You want to make sure that the information matches with the book. The Evolve site, you do not have to worry about whether the information matches with the book, because the Evolve is actually is directly related to the MedSurg book. Kaplan is not. So if you find different information on Kaplan and different information in the book, then we will go with the answer that is best described in the book. All of the test questions come from the book. So if there is a slight discrepancy between a Kaplan answer and a book answer, the book answer will prevail as the best option. So there are things for you to practice. There are things for you to discuss in each of the modules. There are things for you to prepare yourself in a proactive way to be successful. The next tab is the assignments. That includes weekly discussions, the clinical case study, which is due by module 14. But I do recommend that you start working on that a little bit early, maybe 2 weeks, 3 weeks before the case study is due. As you get closer to the end of the semester, things will get a little bit overwhelming. So that is the reason I say to start working on the things. If you can start working on some of these things as early as you can and get them ready, and then you can post them on the day that they're due, that would be really good. These are the exams here. So in general, exam 1 is going to be due week 4, exam 2 week 8, exam 3 due week 11, exam 4 due in week 14, exam final comprehensive will be due in week 15, and Kaplan exam will be due in week 13. How do you take the exams? You will take the exams using ExamSoft. The exams will be set up for you to download one day before the exam is due. So make sure that the ExamSoft software is updated with the most current updates, so you do not have issues on exam day, as that will increase your anxiety level. When we set up the exams, we also set them up with immediate reviews, which means that a proctor will proctor the exam and will also proctor the immediate reviews. Only incorrect questions will be visible for the immediate review, and the immediate review will only last for 15 minutes. No book, no paper, no notes, or watches or calculators or anything will be allowed as you do the actual exam and the immediate review of the exam. And again, when you finish the exam, please exit the room and do not speak with students who have not taken the exam. Okay? missing exams. It is your responsibility to know when the exam is due, the time, the location. It is all your responsibility. Everything will be laid out for you, but you have to make notes on your calendar and organize it in a way that you remember all of the due exams. The makeups are not permitted except if there is a medical emergency. We are very strict on this rule of not allowing makeup exams. Only if there is a medical emergency such as death in the family. If there is such a thing, you must contact the program director, Dr. Wendy Moore. Contact your didactic faculty in charge of that section, and also CC or email the lead faculty. So you can do that all in one email by emailing the program director, and then you can CC the course faculty and the lead faculty. That way we are aware of the situation, and then we will make a decision based on the emergency. But again, please try to, you must do your 100% best to take the exams on the due date and time. If approved, still 10 points will be deducted for the makeup exam. And the makeup exam will be a different exam. Same content, but different exam questions to maintain the integrity of the test. I believe this is all I have to say for Nursing 421. I wish you the best of luck as you progress through your nursing courses. Again, welcome to Nursing 421. It is a heavy workload, but it is one of those courses that critical thinking, clinical thinking, and reasoning must be enhanced in order for you to provide safe, efficient, and effective care for your patients. Thank you very much.